Hi, let's talk about how a twin birth might be different than a regular birth or the birth of a single baby. Got these intervention cards here. This is what a natural birth starting on its own with few interruptions might look like. And I'm going to go through these cards and show you how a twin birth could be different. So let's say you're pregnant with twins, labor starts on its own, and you're going in pretty healthy, no complications expected. You wouldn't have a choice of birthplace, and in many hospitals, you'll be asked to birth in the OR rather than in a birth room, and you'll have an obstetrician. At some places, you might know who that is, but in most other places, it'll be whoever is on call that day. So you won't probably do early labor at home. Most people with twins are asked to come to the hospital earlier. And you will likely be told no eating, no drinking anything but maybe ice chips or some clear fluid. And most places are going to ask you to have at least one IV in place as well in case things change quickly. Let's see how we're doing here. Continuous monitoring will also be part of the process. Now, of course, all these things are optional. You can talk to your healthcare providers about this. You can say yes or no to any and all interventions. I'm telling you what the sort of standard package is here. Um, let's see here. So this looks like, you're giving birth probably in the OR with the on-call OB. You'll be told go to the hospital early. Don't eat, don't drink anything but clear fluids. Continuous monitoring. That'll be 3 straps on the birthing person's abdomen and probably an IV. You might be asked to wear a hospital gown instead of your own clothing. I've seen that happen as well. Okay. Not sure about skin to skin. Now that depends. Even in hospitals where the standard is skin to skin care after the baby's born, there might be some kind of a policy in place that all twins have to just quickly go over to the warmer to be assessed, or you might get your baby skin to skin. So find out in your birthplace about that. Delayed cord clamping may or may not be an option. It depends on many factors. Ask your obstetrician about that ahead of time as well. Even if you could get 1 minute, that's better than immediate cord clamping. But so this is probably in most hospitals, this is kind of what it's going to look like. Now, many people with twins are asked to get an epidural just in case. There's a lot of just in case we have to run to the OR, just in case we have to do a cesarean. So a lot of people will have an epidural. And what comes with an epidural? Being confined to bed. Uh, that doesn't necessarily mean you have to lay on your back, but being confined to bed usually goes with an epidural. Um, Pushing by urge is way less likely to happen with an epidural. And with epidurals, there is a higher rate of vacuum and forceps and episiotomy. I won't leave those turned over because they're not for sure. With an epidural, you won't be laboring in the bath or the shower. Okay. Now, a lot of people with twins, another layer that might be presented to you is induction. A lot of people are induced early with twins. Again, a conversation to have with your obstetrician. And if that happens, then we lose the labor starting on its own card, labor progressing naturally, and you might still have these other things. Choice of birth position. Oh, that one goes to most people when they're catching twins have a very specific way they want your body to be, which is usually laying on your back. That's because there's 2 twins and 2 cords. So that one actually should have gone away with the first stage of interventions as well. Okay. And of course, there is a higher risk of cesarean with twins. So we have this, and then a more difficult recovery as well. If you go into the OR, you may or may not have two support people depending where you are. Uh, Most places will welcome one support person in with you, so that card may get flipped as well. So those are some things to think about if you're having a twin birth, and certainly that can be the start of some nice conversations to inform you. Make sure your obstetrician knows what your wishes are, and maybe you can have a chat and find out where is there wiggle room, what are the regular protocols, but also what is unique to you. Like just because everybody has to get an IV, or just because the policy is that everybody gets an IV, maybe you're okay with that, maybe you're not. That's just an example. And you could have a conversation with your healthcare provider about any of those things. So thanks for watching. If you want to learn more, check out my website and my YouTube channel, social media, lots of info there about all things pregnancy, birth, and postpartum. And I'm Angie the doula. Thanks.